Hey, beautiful people. I hope that everyone is having a blessed day. I just wanted to give you a reminder, especially to my heart warriors. I am at the dentist, well, getting ready to go into the dentist office for my 6-month cleaning. And I just wanted to remind heart warriors and stuff of the importance of dental care. Yeah, the importance of dental care. And just to let people know also, I know you probably, I don't know whether you think about it or not, this is me, this is my humor and everything. When you go into the dentist office, make sure, before you go to the dentist office, always make sure you brush your teeth, rinse your floss, rinse your mouth, all that. Make sure that you do that. I don't never like nobody looking at my mouth except for the dentist anyway. But always make sure you do that. And when you're going to the dentist, also make sure you clean your nose, because think about it. You are reclined back in the seat. So they are seeing whatever orifice is open, they're seeing it, so just, and I think that you'll do the hygienist and the dentist. I think you'll do them a big service when you do that. But I mainly wanted to let you know about to get on here and tell you how important it is for people with heart. I hate to say that word disease, but heart illnesses or whatever that the teeth is very important. All right. And, I was just thinking, and I saw this video clip of this 103, 104-year-old black woman, right? This queen. And someone, they always ask the elderly, they always ask them, what's the, what am I trying to say? What's the secret to a good life? And stuff like that. Or if they are married for a long time, 30, 40, 50 years and stuff like that, they ask them, what's the secret to a long marriage and all this kind of stuff. Well, they asked this black queen that simple question. How do you maintain sustain, a long longevity like this and stuff? You know what she said? Mind your business. Mind your business. And that is so true. If people spend more time minding their own business and leaving other people's alone, this would be a much more pleasant world. But I'm going to go in here. I'm early. So it's so nice and it's just nice and peaceful. Nice and peaceful. People are at work or at home or whatever doing their thing. It's early. It's like 8:30 in the morning. But and also I hope that you all are enjoying the lip syncs and stuff. And I got my first lip sync request, and it's coming up. But let me see, what else did I need to tell you all? I think that was it. I wanted to tell you about the dentist and stuff. And across the street, oh, I wanted to tell you about the importance of dental hygiene, especially when you have heart disease, as well as I have the best doggone hygienist in Eastern North Carolina. Yes, I do. Her name is Tanya. And Tanya And I, been in the military and stuff, and I'm gonna tell you, I've been to many dentists. I even had a botched root canal done. Yeah. But let me tell you, my dental hygienist is the best. Several months ago when I came for my checkup, my cleaning, they told me at the last minute that she wasn't available. So, and I wasn't pleased with that at all. And the dentist there, they are very good as well. Also, they gave me a couple of dental cleaning trays, the boxes, and that you put like false teeth that you put up has a lower tray and an upper tray for your teeth. When I did a fundraiser and I went to different businesses and tried to get something that I can just have for giveaways for people that was doing my heart walk, I came here and that's what they gave me. And those things are worth well over $200. Now, I know I brush my teeth and all that. I brush my teeth, I floss, which I do anyway. But, I be self-conscious when people be in my mouth or looking in my mouth. So I try to make it as pleasant as possible. So. But anyway, hand sanitizer. I got my water. I'm not going to take my water, though. So, well, let's go see. I hope it's not too bad, in 6 months. Oh, and one thing that my hygienist turned me on to a couple of years ago is a electric toothbrush. I didn't realize how well the electric toothbrush does, but it actually works really well. When I first started to use it, I was like, oh, it don't seem like it's, really scrubbing my teeth or anything. But as I started to use it more and I get used to it, I was like, oh, and then my hygienist was like, oh, I can tell when my patients have use the electric toothbrush and stuff like that. So, don't be afraid to talk to your hygienist, your dentist, or whatever. They working on your mouth. That's personal. I mean, you can talk to them about what's up. So, but anyway, let me get on in here because I have a 9 o'clock appointment. But they told me to come in at 8:45. Asked me if I can come in yesterday. They called and asked me if I can come in at 8:45. So I'm gonna go ahead and go up in here and so I'll see you all. How boy said in Hoolum, he said I'll see you in 2 ticks, in a couple of ticks. I love that movie because I love Lawrence Fishburne. But anyway, as an actor, he's an awesome actor. I loved him ever since he was a kid in the Cornbread Earl and Me. Yeah. But anyway, let me get in here. And if you all are ever in Jacksonville, North Carolina, and you're looking for a good dentist, check out Eastern North Carolina. They changed their name to Eastern North Carolina dentist or something, but it is Eastern North Carolina or something. But it's across from. I'm gonna show you that it's across from the mall as well as Onslow Hospital. Okay, you don't want to go there. Okay. Let me see. All right, so I'm just gonna take you with me. Yeah, why not? And also the young lady, I ain't gonna say young lady because, but the receptionist here is so awesome. Her name is Leah, and she speaks like this. And she calls me by my government name, and you know she speaks real soft, and she knows that I go from 0 to 1,000 if things ain't right. But this is see the mall is over there, and that's Onslow Hospital there. You can see it peeking up above the trees, and this is an office park. But yeah, I got the best. I have the best hygienist, and my optometrist is in this. It's in here as well. So the doctor's park. So I will be seeing you all in shortly. Y'all, I felt naked. I just turned around. I'm feeling whimsical. I'm feeling whimsical today, so I'm going to put my little monkey mask on. All right, and I'll be chatting with y'all when I come out the dentist. Well, y'all, okay, I'm back. So I got my cleaning, and I got an appointment for a crown. Well, not an appointment. I got they're gonna send off the estimate for a crown from to my insurance, so that insurance company, so that I can get a crown on that tooth down there. Cause I have some teeth that the Marine Corps, I ain't gonna say not the Marine Corps, cause the Marine Corps don't do that. The Navy dentist botched up with fillings, with those black fillings and silver fillings and stuff back in the day, like in the 80s. So they like over 30 years old, y'all. And what has happened, the silver filling that they did, I need a root canal now because it has broken off. You know, it's chipped, but it has gone down deeper into my my gum. So, but anyway, I need a root canal, and y'all know root canals are not cheap, but hopefully my insurance will pay half. Hopefully my insurance will pay half. So that's... Ooh. Ooh. No, not even half. Well, over half. So that means that I would have to pay $597, y'all. I would have to pay $597. And so what I'm gonna do, and I don't have to pay cash right then, but they want it in 2 payments if I decide to do it in 2 payments. And see, that's the thing when you don't have you have insurance, but you know your insurance don't cover certain things, you know, like dental. I need separate insurance to, you know, for it to cover all my dental needs, but it covers the most important ones. But it doesn't cover cosmetic, you know, VA stuff doesn't cover cosmetic surgery and stuff like that. But they will cover, they should cover this, and they're gonna send out my they're gonna send the bill estimate to my insurance company. And if it's going to be that fee, then if they'll cover it, then I'll go ahead and cover the $597. Because like I said, you really have to have your teeth together. And I like to eat too. I like good food. But you really have to have your teeth together for when you have heart disease. But I've always liked to have my teeth together anyway. I'm a teeth person. A smile, So anyway, well, I'm gonna go and get me some. Yeah, I had to go get me some breakfast. I thought I wasn't gonna be able to go and get any, but I was so glad to see my girl Tanya. Oh, Tanya. I had them laughing up in there because when I walked up in there and I saw Tanya, when Tanya called my name, and she was like, how you doing? How you been? And it's good to see you. And I was like, it's good to see you too. And then the ladies was at the desk and I was walking back there with Tanya and I looked back at the ladies and I said, hey, y'all, I got Tanya. Tanya is my girl. I call it the sand blaster with the salt and stuff on there. The salt and stuff in there. I call it the sand blaster, but I'm sure you all know what the technical term for it is. But when she uses that, I'm like, oh my God. At first I thought that I wasn't going to be able to eat anything for a while because my teeth back in the back was a little sore. But, hunty, she did a great job. I had another hygienist that was good years ago at this other office, but I think that she ended up leaving that office. And the dentist wasn't all that. He was more of a money man. He was more of a money man, so I didn't, But anyway, y'all, got that done. And then next week I have my, since I have, congestive heart failure and the defibrillator, I have to I'm supposed to see my primary care doctor every 6 months, like a yearly checkup. So I have to see her next week on the 23rd. And then on the 21st, I have cardiology in Wilmington. That's about an hour away. But, I don't mind. It's something positive. It's something for my health. So I'm going to go ahead and look around and see. I think I may just go to Chick-fil-A. No, do I want... Well, anyway, I'm going to figure it out. I'm going to figure it out. I'm going to go ahead and give me something to eat. But in the meantime, in between time, thank you all for watching. Remember what I said about preparing to go to the dentist. And when you're at the dentist, make sure you clean everything and stuff. You know what I'm saying? But I will holla at you soon. Because you're going to see a lip sync, a mukbang, or something coming your way. But until that time, y'all be safe. Hey people, hey beautiful people, I hope everyone is having a blessed day. Well, I attached my dental checkup along with my cardiology checkup, and everything, all is well. They just startled me a little bit when they were checking my device and said, it's just skipping a few, skip every now and then, but it's nothing to be concerned about. But Y'all know, anybody that knows me, you know that I get stressed every time I go to a doctor's office. But it is preventive maintenance. So it's just like, your vehicle. You do preventive maintenance on your vehicle, you got to do preventive maintenance on yourself, you know. Like, for example, with your vehicle, if you stop putting oil in it, you may throw a rod, meaning you may destroy your engine. The same way with your car. Your car is your vehicle. It's how you get around. It's how you do things and everything else. So I just had my appointment and I am on my way back to Jacksonville, which is an hour's drive, which is no problem. But to God be the glory, because everything turned out well. And I always say a prayer as well before coming to my appointments, or even before getting on the road, you know. But thank you all for watching. And remember, especially for my heart warriors, heart health is dental care is very important when it comes to heart health. And I also want to go ahead and tell you about an organization, my organization, in which I'll be getting together very soon. With my organization, it is called Heart Healthy Heroines and Heroes. And with Heart Healthy Heroines and Heroes, I actually began this organization, I want to say in 2018, I want to say. Actually, a little before 2018. And it was for, let me say this. I did a fundraiser. So for one of my fundraisers, I did a heart walk. And that was because of my condition, as you know. Well, my organization is called Heart Healthy Heroines and Heroes. And I'm in the process of getting a 501(c) for it. And what will happen, I'm in the process of getting a 501(c). Was I breathing hard? Excuse me. I'm in the process of getting a 501(c) for it. So with that, I have a mission statement, and that mission statement is a few things for the mission statement, and one of them is to This is my June Cleaver look, y'all. Y'all like? This is my look. Hey, this is my look for today. But yes, my organization is called Heart Healthy Heroines and Heroes. And what it is like I said, I had did a heart walk. And the mission statement is, I'm going to help to provide, I hate to say the word heart disease, but it's for people that have heart disease, not just congestive heart failure and a defibrillator, but any type of heart condition that they may have. If they want to belong to the organization, they can belong to it. There's no fee for it. But as I said, I'm going to be getting a 501(c) for it, so in that way I'll be able to do more things and receive money for my organization, to run my organization the way I want to. And it's going to be 3 things that I would like to do with this organization. And one of them is to help people, make live phone calls to those who need live phone calls for encouragement, or just, to check up on them and things like that. The other thing is going to be to provide a heart healthy box, like maybe a fruit box or, something like that reflects on heart health, to provide that to the organization members, um, maybe once every 3 months or once every 6 months. And then the other thing is going to be able to provide them with the resources that they need, like for those who don't have insurance, or for those whose medication, they can't afford their medication, or however it reflects to keeping them going and keeping them motivated and keeping them healthy during this time, um, which is, most of the time it's going to be the rest of your life. Um, that's what I plan to do. So you're going to be seeing videos shortly of my organization. And as I said, I am in the process of having a 501(c) for my organization. And once I have that, I will let you all know. Also, today is the day for the 100 envelope challenge, and that's what I'm going to do today. I'm going to go and get my envelopes. So I just want to thank you all for joining me, joining my channel, joining me for this vlog. And it may not affect you. It may affect a friend or a loved one. I'm sure that we all have someone that we know, or someone in our family that has been affected by heart disease. Let's bind together, whatever you want to call it. Let's get together and help each other to get through this chronic illness, because there is so much technology, and thanks to God, first and foremost, thanks to God and technology, there is so much that can be taken care of nowadays, And if you please watch your salt intake. I'm not preaching to nobody. But my heart warriors know. Watch your salt intake. And I love you for free, and I appreciate you rocking with me, and I appreciate you listening to me. I'm not trying to preach to you. And you all have a safe and blessed day. But also, like I said, the envelope, I may put this on here, connect this with the video to show you that I'm going to get my envelopes today as well. But y'all stay rocking with me, okay? June Cleaver. So my cardiologist said, I told the nurse this is my matronly June Cleaver look. I've been asked why I always dress up when I go to the doctor. There was something I was taught ever since I was a little girl. My mother taught me to always be dressed up when you go to the doctor, and most of all, never ever wear jeans. I don't know why, but it stayed with me. So anyway, y'all have a blessed day, and I love you for free.